As a nurse manager in the emergency, of course, we are receiving patients, all sorts of patients, not only COVID patients, we're also receiving the emergency patients. So my duty is to make sure how to receive patients, where to allocate them, who should take care of them, and of course making sure that the patients are safe. My main inspirations are actually my parents. My parents, both of them are physicians. And they didn't want me to go into medicine. They actually wanted me to be a nurse. And I remember very well, my mom was telling me, both of them, but mainly my mom, she was telling me, Reem, there are enough doctors in the world, but there are not enough nurses. So you are needed more than anyone else. So, and doctors depend on you. Working in the emergency on its own is overwhelming on its own, without the COVID. We're used to this. I've been in this, as I said, for 10 years, so I'm used to coping with this by being calm, patient, and dealing with situations very calmly. This is very important in the emergency. Now to add the COVID-19, I'm not gonna lie. I am always anxious and scared of many things. One, people not listening to the health authorities, to their guidance, and to us also healthcare professionals, telling them not to go out, everything what we are trying to tell them, and to take it seriously, because this is the only way to spread the virus. Second most for is my daughter and my husband. Since you already mentioned that I'm the only breadwinner in the family, I'm always worried that God forbid if anything happens to me, if I fall sick, if I get the virus, I won't be able to provide for my family. I won't be able to be with them even. And what's even worse is that possibly giving the virus to them if I get it by any chance. So I'm trying my best, not just me, the whole team, to take all our precautions, all the proper measurements, from wearing the PPEs, sterilizing properly before going home, so I can be able to hold my baby and my husband mainly. So of course we have measures to take. The main message I want to give to the world on International Nurses Day is that help us help you, please. In order for us to help you and care for your loved ones, you need to also listen to us and stay at home and help us not spread the disease. We also have families. I have a baby, I have a husband, I have a mom. My colleagues, they have also their families with them who are also at high risk to getting the virus. So just like we are spending time away from our families to care for you and for your loved ones, we need you to help us to do so. We need to achieve it. You need to help us conquer and overcome this pandemic. And I want everyone to just remember this time and appreciate the nurses. Unfortunately, nurses are underpaid, underappreciated all over the world. I'm not gonna just talk about here, everywhere. So people need to understand and know our importance and how crucial it is for the nurses to be at the hospital. If it wasn't for us, who would take care of everyone?